Good afternoon, everybody. It's Wynn Brown at Heywood Healthcare with our COVID-19 update for Friday, the 23rd of October. Go right to our testing numbers. Our cumulative positive rate is 2.3% versus the state at 2.6%, so that's relatively stable. Our 7-day rolling average increased to 1.4% from my Wednesday report, which now matches the state at 1.4 as well. So the state is up and we are up. So again, we'll talk a little bit more about what we need to do as a community to tamp that down. Just some statistics for you to bring you up to date as of today. In Massachusetts, 5.4 million people have been tested. Well, actually, there's been 5.4 million tests, which represent 2.5 million people, almost 2.6 million people. So a number of people have had more than one test. With 143,927 positive virus detections in that testing. And the state is inching up on 10,000 deaths at 9,810. Worcester County, we've had 15,778 cases, and Franklin is at 456. I want to give you all an update. As you know, this week we delved right in and working on getting all our direct care employees and members of the Heywood Healthcare family tested, as well as staff who work regularly in patient care areas. And we have collected 862 specimens from staff. If you think about that, that's a little more than half our staff, because we're about 1,500 employees. We have had so far the results back from LabCorp, 504 negative results, 1 positive and 1 indeterminate. And remember, if you got my email earlier this week, the 1 positive was actually a community acquired and already known, and that staff person has not worked at Heywood since I think the 30th of September because of the family having tested. So, and then we have 1 indeterminate, which we retested that staff person today, and that just means that the sample was not good enough to be tested, or that perhaps they were using some sort of nasal spray that could have also been an issue. So we'll have that result back to you. We expect hopefully some more results tonight, and if we get some, I will give an update via email for everyone, because I know everybody's anxious to know their results. So we are seeing an upward trend in positive cases with people under age 50 in the Commonwealth, and so we really need to think about this, because 70% of the positive findings in the state right now are coming from under age 50. So we got to think about what we're doing. So I encourage you all to continue your best practices, not only at work, but also out in the community. And the community who sees this, really take this to heart. Wear your face mask, wash your hands, keep your social distancing, don't go to big gatherings. Really be thoughtful about that so that we can keep the disease load low in our community so we can handle it. It's now my pleasure to turn it over to Rosanna Penny, who's our Vice President of Perioperative Services and our Chief Anesthesia Nurse, to give you an update on what's going on around the rest of Heywood Healthcare as we continue our journey to be one of the best community-owned health systems in America. Thank you.
Thank you, Wynn. My name is Rosanna Penny. I'm the Vice President of Perioperative Services and Chief Nurse Anesthetist in our OR. I would like to start off by making some COVID reminders. Because of the uptick in positive COVID cases in our community, and particularly the uptick in asymptomatic COVID cases, that means patients who don't have any symptoms but are still testing positive for COVID, we will have to restrict visitation to our hospital again, similar to how we did it in the spring. Specifically, patients who are on comfort measures only will still be permitted to have 1 healthy visitor, as well as laboring mothers on maternity unit will also be permitted to bring 1 partner or a visitor, or whoever they choose, a support person. But all the other patients will not be allowed to have visitors as a general rule. So, for example, patients coming for outpatient services will not be able to have anyone accompany them at this time unless there is an extenuating circumstance. So, for example, in perioperative services, we have our pre-testing nurses as well as secretaries call patients before their visit, and at that time they ask patients if they have any special circumstance or anything that will make them need a support person or somebody to help them. For example, if a patient is forgetful and they need to have their spouse or son or daughter to come with them, or if it's a minor, a child, or any other issue, then we make a note of that on the schedule and we pass that on to security, who then communicate with people at the front door. By the way, people at the front door are doing a terrific job, and please remember that it's tough for them out there. A lot of them don't have extensive healthcare background, and they are kind of thrust into the situation in the most challenging of times. So please remember to be kind to them. Thank you goes a long way. Another gentle reminder is for staff to remain hypervigilant. Please continue to remember to wear your masks. As you know, everybody in the hospital now wears a mask, including visitors and everybody who comes here. Make sure to do proper hand washing. That is still our strongest defense from any germs. And continue to adhere to social distancing and maximum occupancy guidelines for break rooms. Eye protection is also recommended for staff in clinical areas. I know the break rooms have been an issue for many areas because we don't have a lot of space and our staff obviously have to eat. So just try to do your best, because we definitely don't want to see another outbreak, with break room being a source of that. And now for some positive news. This week is National Hospital and Health System Pharmacy Week. Our pharmacists and pharmacy technicians are some of the unsung heroes of healthcare. They continue to work tirelessly behind the scenes to ensure that all of our healthcare providers and nurses, physicians, and patients have the medications that they need. So we have 13 pharmacists and 12 pharmacy technicians working behind the scenes to ensure availability of needed pharmaceuticals for our health system. If you see any of them, please wish them happy pharmacy week and thank them for everything that they do for us. Now for patient experience. This is what patients have to say about our Heywood Pediatrics. Teresa was amazing. I felt like she truly listened and took the right steps to make sure that my child will receive the services that she needs. I am grateful that she took the time to talk everything over and send a referral for my child after feeling like I haven't been heard in the past. She is a blessing. This was in reference to Teresa Conniff, PA. The next one is about Kathleen Telepsiak, nurse practitioner. I am so happy that I chose Heywood Pediatrics to care for my child. They handled my baby as if she were their own child. Thank you for the excellent care. The next comment is about Dr. Osterov. Dr. Osterov is an excellent doctor who's very involved with her patients. She also has no problem with sending a patient for further testing if needed. She's very caring, great listener, and shows how much she cares for her patients. Sounds like we have a great pediatrics team. If you're interested in switching to a Heywood healthcare provider, a list of providers accepting new patients, as well as their contact information, can be found on our website. And lastly, some community reminders. We have Healthy Harvest 5K, our annual run that kicks off next Saturday. Be sure to register online at the link provided in this email and also on our website. Registration is $25 for anyone over 18 years old, $15 for ages 7 through 18, and free for anyone under 6 years old. Employees can get an early start in their participation by using the Life Center for the timed indoor 5K and Peloton challenge. Details are available in the Life Center. We also have several openings available in both clinical and non-clinical areas. We have workforce needs in healthcare, in Heywood Healthcare right now, so please visit our website. The link is also in this email and on our website, Heywood's website, if you're interested in learning more about working at Heywood. And finally, the Massachusetts Department of Public Health has released a survey to better gauge the effects of COVID-19 pandemic on its residents. Hoping to capture more responses, in particular demographics, the survey deadline has been extended to next Thursday. The survey is available in many different languages. Please consider taking the survey at the link provided in this email and also on our website. So please remember to wear a mask, wash your hands, stay healthy, and be kind. Thank you and have a great weekend.